Hello, I'm Dr. Kathleen Wills from Optimal Wellness Limited Clinic in Epsom, Auckland, New Zealand. I'm an integrative medical doctor, and I would like to share with you some information on migraine headaches today. According to the World Health Organization, nearly 20 million migraines are happening worldwide. And just in New Zealand, we have 200,000 people with migraines. So this is quite an epidemic, and a lot of this is linked to food allergies. However, I would like to go through an outline with you first. I'm going to talk about what a migraine is, what triggers migraines, the symptoms of a migraine headache, as well as some supplements that could be taken and other treatments while you are experiencing migraine attacks. So a migraine it's generally accepted that it has to do with the blood vessels constricting and then releasing, and this rush that happens after the blood vessels release causes you the pain. Estimates also show that 70% of patients actually experience migraines due to drug-related side effects. So I thought this is quite an interesting statistic. However, food allergies are one of the most common triggers, particularly chocolate, cheese, wine. They can cause the blood vessels to expand. In addition, hormonal imbalances can be an issue. So people that are premenopausal or perimenopausal, menopausal, or even premenstrual, if they're too high in estrogen, sometimes this can give you a migraine attack. People that are sensitive to specific chemicals in their foods, MSG, chemicals such as caffeine, this can trigger a migraine. As well as magnesium deficiencies. Magnesium is something our body needs to function properly, and without magnesium, this can affect our blood vessels. Emotional stress can be a major trigger. So when you're holding in repressed emotions, you're tensing up your muscles, and then that tension can constrict your blood vessels and then cause a sudden release. Changing weather conditions, so the atmospheric pressure, when storms are coming, a change in weather, all of these subtle differences in the air and the weather, our bodies actually sense these. Excessive fatigue, perhaps you're working a bit too hard at work, you have too many strains at home with the family or the children, and it's causing you a lot of fatigue. This can cause triggering migraines. Perhaps you're not eating regularly. If you're skipping meals, this can also trigger a migraine attack because your blood sugars get too low. Also, changes in your normal sleep pattern. Perhaps you had a late night last night. This can actually subtly affect your body. So symptoms of a migraine headache include very common ones, such as an aura, which is where you get sort of indications that the migraine is coming by kind of a halo effect or colors coming about in your eyes. Some people know that a headache will occur or a migraine will occur when they get this aura around them. But then others don't get the aura, and they may just get sensitivity to light, noise, odors can set people off. Other symptoms that a migraine can occur, nausea and vomiting, loss of breath, loss of appetite, paleness, fatigue, dizziness, and on very rare occasions people will get a fever. Sometimes they get blurred vision as well. So these are very common symptoms of a migraine attack. Another feature is paleness. So sometimes if I see patients that look quite pale, I might ask them, are you feeling a bit off? Do you feel like you're getting some pains, like cluster headaches, etc.? So at Optimal Wellness Limited, I can help you with supplementation to prevent migraines and also to help you when migraines do occur. So first and foremost, we would need to test you for food allergies. Food allergies are one of the #1 triggers for migraine attacks. So with a very simple food allergy test, we can identify and remove those food triggers from your diet. Secondly, we would offer a series of nutritional supplements, such as a Myers cocktail. This is an intravenous treatment that involves a very diverse range of multi-nutrient therapy, including magnesium. As I said before, some people with low magnesium levels can have issues with migraines. So this is a very replenishing, all-over body treatment to help with your migraines. This is also very effective when you have an acute migraine attack. So if you're having very serious, strong symptoms and a lot of pain, you can come into our clinic and we can give you this therapy, and usually within 10 to 15 minutes, our patients will experience a significant reduction in pain. We also offer vitamin B6 oral supplementation and bioidentical hormone therapies. So as I said before, oftentimes migraines can be hormonally related. So if we give you some progesterone cream, which is bioidentical, it's not the hormone that is prescribed at your GP. This is a hormone that can be readily absorbed by your body through the skin. So you actually rub this progesterone cream on the temples of your face, and it can really relieve those migraine symptoms. Coenzyme Q10 and Riboflavin are also very good oral supplements that we would recommend, as well as some herbal supplements, because I'm a herbalist as well. I would recommend feverfew and ginger. Feverfew has been tested in very many clinical trials and is known to be just as effective to prevent migraines as prescription medications, with very, very little, if rare, if any, side effects. Also, a very important consideration is for people that are having a lot of fatigue is lifestyle modification. So we might give you some referrals for biofeedback, where you can learn to track when your migraine symptoms are occurring and actually understand what happens to your body before this occurs, so you can sometimes fend off a full-blown attack. Relaxation treatments, so we might learn how to breathe, Buteyko breathing techniques, that kind of thing, as well as acupuncture can be very helpful. So these are the treatments and the supplements that I would recommend for a migraine attack. Thank you for listening to me today. I'm Dr. Kathleen Wills.